There we go. Okay, so my name's Ashley Kelso again. Thank you for that introduction. I'm a speech language pathologist. I work at the Orlando Health Advanced Rehabilitation Institute on Gore Street, and then I'm also fortunate enough to work as part of the ALS clinic team with Dr. Tahiti and Dr. Gutierrez. Okay, so my goal today is to let you know how speech language pathologists assist in treating people with ALS and how to maximize treatment and maximize the ability to communicate and swallow. So speech language pathologists help with educating regarding disease progression. We provide strategies for speaking and communication. We also assist in obtaining augmentative and alternative communication devices. We provide swallowing strategies based on instrumental assessments, such as modified barium swallow studies or fiber optic endoscopy of the swallow, or called a FEES. And then we also provide exercises for airway protection if warranted. So I want to talk a little bit about disease progression. So ALS leads to speech and swallowing problems when it attacks the bulbar neurons. So these are the nerves that bring the messages from the lower parts of the brain to the muscles that move the lips, tongue, soft palate, jaw, and vocal cords. So the speech changes that you might notice. The term used to describe speech problems is dysarthria. So that could be when your voice sounds slow, slurred, effortful, hoarse, or breathy. Sometimes what happens is the muscles that are not impacted, or the muscles that are receiving signals from the brain, will compensate for the muscles that are already weak. Your speech may also sound different due to excess saliva, nasal quality, or reduced vocal loudness. So if your volume is reduced, but your speech is still intelligible, you could benefit from a voice amplifier. If you notice that you have excess saliva, your physician can prescribe a medication that might help to control that. And then if you do notice that you have nasal quality, there are specialists that help to provide what's called like a palatal lift or obturator, and it helps to stop airflow from coming out your nose. So that can help with your speech, but you would have to follow up with an ear, nose, and throat doctor that specializes in that, or a speech language pathologist that can assist you. So since we know that dysarthria is from weakness and overcompensation, there's a few strategies you can implement to help your speech. The first one I like to say is to rest. You want to compensate for your speech by adding rest times for speaking in your day. If you are knowing that you have a family event coming up, maybe use your fatigue management, save your energy for when you know you'll be with people. Also, stretching may be recommended to reduce tightness and maintain range of movement. It also can be more relieving to have stretching. So again, following or seeing a speech language pathologist to give you those strategies or stretches would be very beneficial. And then there's no current research to suggest that oral exercises to strengthen muscles for speech are beneficial to ALS. So we won't be exercising to strengthen, it would be for maximizing with compensatory strategies for your breath support, and then stretching for relief and to keep range of motion. And then based on the severity of dysarthria, a speech language pathologist will help with voice banking or voice messaging. Okay, so a little bit about voice banking and message banking. So voice banking and or message banking is a way for someone to record or save their voice. Voice banking creates a custom synthesized voice based on the samples of your speech. So think of an AI version of your speech, almost like Siri. You would follow this program, which there are many out there, and then they create a synthesized version of your speech that can be used as speech output, and whatever you type into your device, it would come out as sounding most similar to your speech. Message banking is the process of recording meaningful phrases or expressions that can be played later. So that might be if you want to say, "Hey honey, how are you?" You can actually take that recording to be used later should you have problems communicating later on, so that you can still have those meaningful messages saved. And so there are so many voice banking and message banking services. I don't like to tell patients which ones to choose. I provide you with the ones that are out there and help you to make an informed decision on which one you believe would be beneficial. Voice banking, actually to go back, voice banking services, they do vary in price, so there's a lot of really good resources out there, such as Team Gleason. They can help to pick up the cost of voice banking and messaging services. And again, a speech language pathologist would help you to find those resources or help guide your decision. So different types of augmentative communication. AAC is just another way to communicate. So we're assisting your communication. There's low tech, which is basically letter boards or communication boards. And so you're able to use letter queuing, providing the first letter, or topic queuing to help so that you're able to still communicate just with a little bit of assistance. And then high-tech AAC, or SGD AAC, is to assist with communication. So these are some types of low-tech AAC. The one on the top right you're seeing, that is for topic queuing. So if you have a little bit of difficulty being understood, by knowing the topic that you're going to communicate about, your communication partner may be more likely to understand you. There's also letter queuing. So if you have a hard time maybe getting that first sound out, giving the first letter can really be beneficial with your communication partner. There's also yes/no boards for easy access, and then having a pain scale or a scale of the body so you're able to indicate pain. These are examples of high-tech AAC devices. And so there's many different companies out there that create these devices. If you walk around the Learning Lab, you'll see a couple out there. So I wanted to take screenshots of just the interface of what the difference would look like. A lot of people ask me, what's the difference? It's really your preference in which layout you like, what type of buttons you like, what big of a device you'd appreciate. So these are just the interfaces that you can see. You can use a QWERTY keyboard, just a letter keyboard. You can also have it by different topics or phrases that are pre-stored. An example of what the device would look like is this. So this is just one device out of many that you could get. They're typically either iOS-based, like Apple-based, or they are Windows-based. So this is a Windows-based one. But again, if you guys check out the Learning Lab, there's a lot of devices out there that you could take a look at. Okay, so thinking about accessibility. If you want to use an AAC device, sometimes using direct access or our fingers aren't always the best option. So we can use an eye gaze or an eye tracker or a head tracker, a stylus or a switch or a joystick. And again, if you were to see a speech language pathologist, they would be able to help you to determine which access method is best for you. So the biggest question I usually get is, how do you get one of these devices? A lot of my patients say, how much is it? Can I just buy it outright? But first, you'd get a referral from your physician. And then the physician would send you to a speech language pathologist that works to create the eval for the AAC. That usually looks like having a few devices in front of you, so you're able to decide which one best meets your needs. The evaluation process is usually about 2 hours. And then again, they're just showing you different types. They're seeing what access methods work for you. Maybe it's a switch, maybe it's your eyes, maybe it's a stylus. And then from there, we decide which one we want to proceed with, and we submit it to the insurance. That process can take anywhere from 3 weeks to 3 months. It just depends on the process of the insurance and if we receive any hiccups on the way. But we try to do it as fast as we can. And then for funding, again, Team Gleason is such a great resource. They can usually help with the funding with co-pays or whatever your insurance doesn't cover. So, swallowing. Speech language pathologists assist with swallowing changes. We help to diagnose problems with what's a modified barium swallow study or a fiber-active endoscopy swallow or a FEES. So the goal of these is to determine the least restrictive diet or compensatory strategies for your swallowing. Swallowing symptoms might include coughing or choking, especially when you're having like thin liquids like water. Increased saliva, so you might notice you might cough a little bit on your saliva. Sensation of food getting stuck in your throat, or if you notice fatigue while you're eating or loss of appetite. And then the picture that I have there is actually what is a modified barium swallow study. You're drinking barium on an x-ray so we can see if anything goes the wrong way and what is safe and unsafe. And then from here, it would be determining if we need to adapt the diet or do a strategy like a chin tuck or a head turn. Again, this is with the speech and language pathologist, so they determine what is best for you. Okay. And are there any questions regarding speech, swallowing, or AAC? Sure. Oh, sorry, I'm looking at. Yeah, I think they'll bring in one right now. Perfect. I'll go ahead and start with you if you're ready.
Hello, my name is Hide Kubota. I live in Gainesville. My wife, Susan, over here, attending this conference. And first of all, thank you very much for having this conference. It's great to meet people with the same diagnostics. And my wife was diagnosed a year ago, but hers is a bulbar palsy, so mostly impact swallowing and the speech. So I have a question about the speech. She has gotten all the equipment and so forth, but she has not gone down that far yet. She can still communicate, but I was wondering if any particular speech therapy that we could you could train her certain ways. And some of the words are difficult, but you can alternate to different words, choose different words, or enunciate, or something like that. I wonder if there's any particular speech training.
Yeah, so his question was if there's any particular speech training. I would love to meet you and hear you. It's very individualized. We work on strategies for breath support, over articulating, so really focusing on that first sound. It just really depends on, we'd have to listen to you communicate to hear. Another good way is if you're heard most of the time, but maybe some words are more difficult, that low-tech communication board would be really beneficial. And there's different types you'd be able to explore. Oh, you have a boogie, is that a boogie board? Oh, I love boogie boards. Yes, those are really, really convenient. So writing it is definitely a great tool, writing the context. So if you know you're about to talk about your favorite place that you guys like to visit or your children, writing just the topic, and then your communication partners will say, okay, now we're more in tune with what you're about to say.
Yeah, she's been using this writing device, which is very excellent tools, but because she loves to talk, so trying to preserve her speech ability as much as I can. But I think there are, being linguist, I think there's certain words that are hard to pronounce bilabial and using the tongues and so forth. There's some trick to some of the speeches that so you can make it sound, pronounce the words differently, and it's more intelligible to other people. Those are kind of tricks that I was looking for.
Yeah, we would, the speech pathologist would work on tricks as able to. And then if we're looking at, because you said you like to talk, increasing the rate of ability to speak, we want to keep talking verbally, of course, but I really would encourage you to look into other access methods, even if that means giving your voice a rest, so that when you are ready to talk, you're able to have more energy to speak. But yes, that's a really great question. It just really depends on how much movement do we have, what strategies can we use, are there better times of the day that you're able to communicate than others? So saving your good periods for when you're going to have those conversations. So speech language pathologists can specialize in communication strategies. So it'd be helpful to look to see if there's any within your area, or if you're seen by a multidisciplinary clinic, but definitely can give you more strategies as needed.
That would be great if you can recommend some of the speech pathologists in the Gainesville area or something close by.
Okay.
And she does have some swallowing and trainers and so forth, but she does not provide particular speech tricks and so forth. But so I think that would be a great, gives her, my wife, a great satisfaction if she can communicate with people. And as writing does take some time, and there's a time lag and so forth. It's a nothing really replaces being able to speak.
Yeah. I'll follow up with you guys afterwards if possible and see if we can find any speech pathologists in your area. Yeah.
Hi, my name's Bob. My tongue is getting much weaker. Is there any exercise for the tongue?
So use of exercise for the tongue for strengthening is contraindicated in speech. It's kind of a hot topic, honestly, because we think we want to exercise it, but really your best strategy would be to do gentle stretches or passive range of motion stretches, but there's no exercises for the tongue at this time. So, but if you're having difficulty communicating, that's where a speech therapist could come in to help with compensating, or maybe strategies if you're having a hard time because of the weakness moving food to the side or to the back of your throat.
Yeah.
Yeah, that's one of the first symptoms, is having difficulty moving food from the front of your mouth to the back of the mouth. So speech language pathologists can look at different strategies to help so you're able to do so. I do recommend a swallow study, such as like the X-ray one that I spoke about, the modified barium swallow study, because they can see on the swallow study, hey, if he has the ability to tilt his head back, or maybe do a sweep to get the food back, or maybe we have to add moisture, what would be beneficial?
Okay. I'm also losing my appetite and losing weight. What do you suggest you should do?
So if you're losing weight and losing your appetite, that's a really good time to let your physician know, and then consider speaking with a registered dietitian. They can help with seeing your caloric intake and adding fats. I can tell you some basic ones, like having high calorie meals, maybe protein shakes, or like healthy fats. But I really recommend that you see someone that can individualize your nutrition and intake plan.
Okay, that's a question. I use EMST.
Great.
Have you heard of this?
I have one in my pocket.
Right.
So,
And can you tell everyone what it's used for?
yeah, so I'm glad you have one. I'm going to ask, are you seeing a speech pathologist right now?
Um, I'm kind of up in the air.
Up in the air. I'm just going to explain what you were talking about. So we first talked about tongue weakness, but then we talked about appetite, and then also he talked about how he has this device called an EMST. So this is a device that's really researched in prolonging swallowing problems in ALS. But I really recommend, if you do get this, that you're followed by either an interdisciplinary team, like a respiratory therapist and a speech language pathologist. If you get to the point where you're having a hard time with coughing up your secretions or getting phlegm stuck in your throat, it might be a time to take a break from this, because you need a certain max pressure, or FVC, which sounds like mumbo jumbo, but you don't want to do it when it gets too difficult for you. I also say that this device is a trainer. It's different than an inspiratory spirometer that you would see like in the hospital. The way it works is you add resistance and you work up the muscles that you need for airway protection and swallowing. But when you're doing it with ALS, you're only supposed to do it at your max MEP, or the max pressure you're able to blow out. So I really recommend if you consider a device like this, again, it's called an EMST, that you follow a speech pathologist to make sure that you're doing the appropriate amount or the appropriate resistance strength. So that's really good that you had yours with you. I had mine too. Any other questions? Sure.
I went about almost a year of choking on my saliva, and then I was introduced to this about back in March. It's alpratine sulfate, and I want to make sure everybody else knows about it. One drop under my tongue, my saliva choking has gone away. I use it 2 or 3 times a day.
Oh, that's wonderful.
If there's anybody who don't know about it, maybe you can share it.
Thank you a lot for sharing that. So he wanted to share, you said it's do you have yours too? Oh, that's fantastic. All right, everyone take it out of their pocket now. But thank you so much for sharing that. So he said did your physician prescribe that?
Yes.
Perfect. So yes, alpratine sulfate, was I correct with that? Atropine?
Yeah, alpratine sulfate.
Oh, yes. So that's used usually to treat eyes and glaucoma, but it's also used underneath the tongue. A lot of people are nodding their heads.
I don't know if that's it, but 6 months or more ago, I couldn't hardly move my tongue at all, and now, even though it's not fully recovered, it's better than it was.
Oh, good. So he said he has increased tongue movement. I'm not sure if that would help with increased tongue movement, but if you have any questions regarding that for saliva management, refer to your physician. Go ahead. Oh, they're coming with the microphone. Thank you again for sharing.
2 things that my sister Jane has gone through. About a year ago, the doctors suggested getting the peg tube put in so that she could still eat and use the peg tube for nourishment. Since then, she's put on 30 pounds. So it has been beneficial. It helps a lot because he said, if you wait, you won't be able to put in the peg tube. So we put it in a year in advance, and she's using it, and she still eats as well. Another thing that we have in the house is a cough assist. When she does choke, we put the mask on her, and it helps tremendously. It pushes the food in and pulls it out. So everybody should have one of those handy.
Thank you for sharing. I'm just going to repeat what you said. So she had mentioned that her sister has a peg tube to supplement her nutrition, and then they also have a cough assist, which again is really recommended too if you do have things that go the wrong way or get stuck. That helps so that they unlodge the food or phlegm from your throat. Thank you for sharing. Yeah.
Yes, I'm here with my sister who has the communication board, but she finds it cumbersome and does not like to carry it with her. So she uses her iPhone for text to type.
Yeah.
And she spends a lot, she does not speak in short phrases. She speaks in long paragraphs. And when she makes a mistake, it autocorrects, and the autocorrection is difficult to read. Is there anything in between? Is there a smaller device that she can use for text to typing, or is she stuck between the iPhone and the larger tablet?
So you do have some different size tablets. I don't know any, well, let me ask you this. Are you able to use your hands?
She's very good with typing.
Okay, good. So there are some like iPad minis. So there are, I call it an iPad mini, but they're smaller tablets. If you get a chance to take a look at the Learning Lab, I really recommend you go over to some of the booths. They have all different sizes. There's also applications on your phone. One is called a speech assistant application, or speech assist. It is about $29. So it's texting to speech, but you can pre-program phrases. And then it does have the predictive text. It's a little bit faster, and it has speech output. But no, right now I usually have the big ones in my office, but if you check out the Learning Lab, they have different sizes you can look at.
Aside from using the speech pathologist for teaching or teaching techniques, is there anybody else who assists with that type of thing? She could use assistance with using the devices that are available on the iPad.
Yeah, so a speech language pathologist would be the one that would help you with the different applications on your iPad. Even though it seems silly to go to a speech pathologist, but they really help. I see my patients and we think about ways to increase the rate of their ability to communicate. So we look at different accessibility options on your phone or on the tablets that are available so that it has more predictive text and it's faster.
Thank you.
I think that's it. Sure. And then I'll take one more question and I'll be outside if you guys are able, if you want to ask more questions as well. But go ahead, please.
Thank you. Thank you. I'm not sure this is the right venue to ask this question, so if not, please just let me know. But a moment ago, a lady back here mentioned using the cough assist if you get choked. And I'm wondering, I have wondered about doing that before, and I was afraid that if so, that I would, using the cough assist, I would kind of inhale any food or whatever I might be choked on into my lung. Is that a concern, or is it good to use that cough assist for occasions like that?
I would still, I mean, this is more for a physician or respiratory therapist, but I would still say you're using the cough assist to help bring anything up that could get lodged or stuck. So while you may have concern that it could go obviously where it's not supposed to, the cough assist is supposed to help to pull everything out.
Yeah, but when you use that cough assist, the first thing it does
You
is
take a breath
inhale.
in, yeah. But then you're using the cough assist it's supposed to help expel out. So yes, my patients say the same thing, but I'm inhaling in. I know it seems counterintuitive, but it does help to expel whatever is stuck or lodged out. But, well, I'm going to go ahead and wrap up for now. Again, I'll be outside if anyone has any more questions. So thank you.